Hi. Welcome to another lecture of the Home Care Assistant Program. Today we are going to continue our lecture on drugs. Drugs. In the previous lecture, we looked at drugs, what they are, their names, where they come from, how to give it. We are going to continue with that and going to understand more and more and more. I hope you enjoy this lecture too. Please, this very table is in your manual. As you are going through this lecture or this video, kindly take your manual and open to this very side, this very table. It's going to help. It's some abbreviations that are used in prescription. Please, you need to get as much as possible. Most of them in your head. You have to know them. We say you have to know them by heart. So please, kindly try as much as possible to know them. So the abbreviation and their meaning. Abbreviation and their meaning. We use these terms in the medical field a lot. So please, you have to know them. So serving of drugs. Before you can serve, a home care assistant can serve the medication, you have to understand the prescription. So let's say normally drugs, you have to understand the prescription before you can serve a drug. So we get to know a sample prescription. So what do you mean by a prescription? A prescription is a formula that is instructing you, written by a medical practitioner, that instructs you to serve a medication to a patient. So you always have to know and understand the prescription before you start giving the drug. A prescription contains the name of the drug. It is there that you get to see the name of the drug, the formulation of the drug, or the type of the drug, whether the drug is it is solid, it is liquid, whether the drug is supposed to then you know the route. The route will tell you, the prescription will tell you where the drug is supposed to be given, whether the drug should be given by injection, should be taken orally, to be given under the tongue, should be put on the eyes or in the ears. The prescription will tell you, and to tell you the amount to give, whether to give 2 tablets, whether to give 1,000 milligrams, whether to give 10 mils. It will also tell you. Then to give you how often, it should tell you how often you give the drug, whether you should give it morning only, or morning, afternoon, and night, or morning and evening, or only at night. It will also tell you, and it will also tell you how long or the duration the drug is supposed to be taken. So to tell you to give the drug for 5 days, 10 days, 30 days, it will tell you everything. It's just a simple statement, and that's what we call the prescription. You need to understand it, and mostly we use some of the terms or the abbreviations to write a prescription. The doctor or the medical practitioner won't write all these long sentences. It's just some short sentence, but you need to understand it. So, for example, for the prescription below, we have a prescription: tab paracetamol 1,000 milligram POTID times 48 hours. Please, all these terms aside paracetamol are found in the abbreviations book. The tab means that it's tablets. The tab means that the drug is tablet. Then 1,000 milligram. MG means milligram. PO means that per ora or by mouth. It is also in the abbreviation. TID means that 3 times daily. And 48 hours means 48 hours. So all 2 days. All these are found in the manual. In the abbreviation table that came first at the first instance, and it is also in your manual. So let's see how this prescription, tab paracetamol 1,000 milligram POTID times 48 hours, how it is going to help us understand what the doctor wants us to do. The tab actually tells you the formulation of the drug. So this means that the drug is not syrup, it is not liquid, it's not an injectable drug, but it is a tablet. And the name of the drug here is paracetamol. So the paracetamol represents the name of the drug. The 1,000 milligram talk about the amount of drug, the amount. So paracetamol normally comes in 500 milligram. And so if the doctor say give 1,000, 500, two of the 500 milligram will be 1,000. So you are going to serve 2 tablets. The PO means tells you where you should serve the drug. So that tells you that, oh, it's per oral or by mouth. The TID is telling you the time interval or how often you should give the drug. And normally when they say 3 times daily, it means that within a day it has to be 3 times. And in drug administration, we normally use hours. Even if the doctor writes day, they are talking about hours. So if they say 3 times a day, it means that in the day you should give it 3 times. And the day is like 24 hours. So you just divide it into 3. So if we have 24 hours in a day, then it means that the drug should be served every 8 hours. Don't worry, you get to understand it more. Then 48 hours is telling us that the doctor is saying that give the drug for only 48 hours or for only 2 days. For only 2 days. Let's look at drug formulation. That was the first thing. What do we mean by drug formulation? These are the physical characteristics of the drug. So drug formulation can be grouped into enteral. Enteral means GIT or mouth, or parenteral means outside the mouth. Let's put it this way to understand. So we have drugs that can be given through the mouth and drugs that can be given outside the mouth. In fact, most drugs are given through the mouth. So the enteral or oral drug, these are preparations designed to be served through the mouth or the digestive system. So this formulation can be further be divided into solid and liquid formulation. So we have the liquid formulations. We have syrup. So some drugs are syrup. Syrups are normal sugar preparations. When they say a drug is syrup, it normally contains sugar, so it is sweet. Then we have the bitters. We have the elixals. Elixals, the cough syrups are elixals, and they contain alcohol and sugar or sweetening agent. We have suspensions. Suspension, if a drug is suspension, it has the drug is not dissolved in it. So anytime you want to give, you have to actually shake it before you serve it. Some drugs are powdered form, and when you buy, they ask you to put water in it. Anytime you want to give, you have to shake it. And such drugs are normally suspension. We also have tonic. So these are some of the liquid preparations that we give by. So I have talked about suspension, I have talked about bitters, I have talked about tonic. If you want to read what is there, pause the video and read. Or you can read it from your home care assistant manual. So we also have solid. Solid drugs. So we have capsules, we have tablets, we have pills, we have suppositories, we have pulvers, we have pastries. Solid preparation must undergo disintegration and before it actually gets dissolved in you. So we have capsules. For the capsules, the drugs are actually in something gel-like something. Capsules are what we call the topaye. In a can, if we call it topaye. So you can actually open it. You can open it into 2 and pour the drug. That are the capsules. And you have the tablets, the normal paracetamol tablets. The paracetamol is a tablet. Most of the drugs are tablets. So and you also have the pills. The pills are normally tablet that has some hard coverings around it. So they are very, very hard. And the coverings are normally sugar coated. Most of the multivitamins are in pills form. So most of they are very, very hard. They are hard. At times when you break it, you see that the color outside and the color inside is different. So if the color outside is green, you see that the color inside is at times brown. Some of the multivitamins are in those form. You have the suppositories. These preparations are done in such a way that they are inserted through the anus or through the vagina. We also have the pulvers. They are powdered medications. So powdered medications are actually pulvers. At times you need to mix them before you can use it, or at times we apply the powdered form of just like that. So we have some drugs that we want. At times they will tell you that drug is enteric coated. You may come across it, and these drugs are substance these are preparations covered with a substance that resists it being dissolved in the stomach. So they have some substance around it. So when you take it, instead of the drug being dissolved and being used in the stomach, it doesn't get used in the stomach, but it goes into the small intestines. They also have sustained release. Some drugs are sustained release, and these preparations are designed to release the drug at constant rate. So the drug actually doesn't, all of the drug doesn't get dissolved at a go, but it gets dissolved at some rate. Maybe every 1 hour, maybe a portion of the drug gets dissolved. Every 1 hour, a portion of the drug gets dissolved. And these drugs are also called spansules. They are also called spansules. Sustained release drugs are also spansules. So we have parenteral preparations. These drugs are not given through the mouth; they are given outside the mouth. So we have the injectable formulations. These are the ones that we inject. So we have the liquid, we have the lyophilized drug. Lyophilized drugs are the powdered one you have to mix before you give. As I have said initially, we are not going to teach you how to give injections. We have the topical or cutaneous. These are drugs that are actually applied on the skin. So we have the cream, we have ointment, we have gel, we have paste. So this, and we also have inhaled preparations. We also have inhaled preparations. So these are topical drugs. So this brings us to the end of our lecture, and we've talked about we started with prescriptions, and we ended with drug formulations. We will continue with prescription in our next lecture. I hope you enjoyed the lecture. If you have any questions or contributions, don't hesitate to put it in the group. I'll be there to help you with it. Thank you.